Like I told you, we're heading into the health check straight with Dr. Bhagat. How are you doing, Dr. Bhagat?
Good morning, sir. I think, winter's gone and summer is upon us. We don't really get too much spring here, so I think overnight it just gets hot. So I think we're in summer now.
Well, almost quite, because I still feel the cold on these winter mornings, sir. It doesn't feel like summer's here just yet.
Well, today we're going to end up in our series on mental health. We've had actually an absolutely overwhelming response, which tends to suggest that this is a neglected subject amongst the public. But today is the last in the series, and we're going to leave the worst to the last. And this is a condition called schizophrenia, which everybody panics about and uses the word sort of willy-nilly. But they need to understand what this condition is, because it's a serious mental disorder in which people literally interpret reality abnormally, and it can be a frightening thing to observe for those that have never seen it before. But it's a chronic brain disorder that affects about 1% of the population. And when the condition is active, symptoms can include things like delusions and hallucination. The speech is disorganized. The individual has trouble with thinking and lack of motivation. And, the exact cause of schizophrenia is not understood, but research suggests it's a combination of both genes as well as your physical environment and triggers. Particularly some people may be prone to schizophrenia after a stressful or emotional event. And sadly, people with schizophrenia don't actually recognize that they are schizophrenic. So it's usually the family or the brother or the sister or the wife or workmates saying, the people with they are behaving in a sort of strange way. For example, they can have a hard time organizing their thoughts. They may not be able to follow along when you're talking to them, and instead they may seem to be almost zoning out or distracted. And when they talk, their words come out in a sort of a jumbled and not sensical way. So it's an odd condition, but it's recognized by people that are close to the individual that's having schizophrenia, and it starts generally in one's late teens, early 20s is usually the time that it really is picked up by individuals. And it may wax and wane. It doesn't typically get worse with age. In fact, some people get better with age. So it is something that one needs to be aware of. And the early warning signs are one is that people with disorders often don't realize they're ill. They're unlikely to go to the doctor for help. And what happens is you begin to notice in that individual delusions, hallucination, hearing voices, they're actually talking to somebody that's not there. Sometimes they may have what's called a catatonic episode where they just sit hours and hours and hours in one particular position, not moving at all. So it actually can be quite frightening to see when one has this sort of condition in the family.
I do agree. I think one of the most popular examples of schizophrenia, I'm not sure if you're familiar with it, Dr. Bhagat, there's a cartoon that actually shows all of the realities of schizophrenia. Phineas and Ferb, one of the sisters in the show, has it, and it really shows someone who is hyperactive and I don't want to say all over the place, but so interested in almost everything that is going on around them. It seems hyper normal to be able to behave like that. I think you rushed over what the signs of schizophrenia are, Dr. Bhagat. I'd like to hear, what is it exactly that manifests? What do you see from someone who's schizophrenic?
Basically, the thing that I've seen, and remember, I'm a heart specialist, not a mental specialist, but what my colleagues tell me is they first are told by relatives and family that the speech of the individual is not coherent. They're talking, we call it a word salad. So they'll start talking, but their words are all jumbled up, and then they will look in a particular direction if they're hearing a voice, or they'll look at their hand, and you ask them what they're looking at. They'll say there's somebody dancing on the top of my hand, or they'll say depending on the culture, my spirits are talking to me. My spirits tell me to do this, and particularly schizophrenic that actually do get worse. Sometimes these voices actually tell them to do violent things, which is where we see them on TV as that. Sometimes it's also a flattening of emotions, where they just literally, something bad happens and they just sort of flat. It's something they're breaking up, or somebody's died and they don't actually respond with grief, etc. So it's generally delusions, hallucinations. And if you ask a schizophrenic, are you hearing somebody talking to you? They'll actually say to you, yes, can't you hear them? Or can't you see this thing on the top of my hand? Or, don't you understand what I'm saying? So this is basically what it is. And unfortunately, like with most of psychiatry, there's no test. If you have malaria, you can do a blood test. If you have blood pressure, you can check your blood pressure. If you have cholesterol, you can do a blood test. But unfortunately, MRIs or CT scans, blood tests cannot actually determine your level of schizophrenia, or if you have schizophrenia. It's actually something that a doctor has to sit down and review your medical history and talk to you to see whether you actually display signs of it. And so this is something that's important. Things that can mimic schizophrenia are what are called delusional disorders, or, these are very complicated words, schizoid personality, which means you're sort of borderline. Every now and again, you sort of flip a little bit, Somebody's asked here, is schizophrenia inherited from the mother or the father? Well, while parents and children share half of their genes each, there's actually a very small, fortunately, chance, about a 5 or 6% chance that a child with a schizophrenic parent will develop schizophrenia. So it's something that you need to be reassured about if you have a parent or somebody in the family that has had it picked up. And somebody's asked at what age is it usually diagnosed? Like we talked about, it's sort of mid to late 20s. Can start later, but generally it's around that time. Somebody's asked an important question here. What happens if schizophrenia is left untreated? Well, when people live with schizophrenia without adequate treatment, their mental health can worsen. Not only the signs of schizophrenia get more severe, but they have other things. Unfortunately, schizophrenia comes together with other conditions we've talked about in our series: obsessive compulsive disorder, anxiety disorder, and like you said, also some people can become manic and they become hyperactive when they get it, and so this is really important. Somebody said here, does it damage the brain? Schizophrenia has been described as the worst disease to afflict mankind, It causes psychosis, which is an abnormal state of mind. Untreated episode can result in structural brain damage, indeed, and long-term issues with the brain. Somebody's asked something that we've answered already. Can a CT scan... I know somebody in my family who has symptoms that you're talking about now. Can I send them for a brain scan? We talked about this. Unfortunately, there are no brain scan images that actually detect schizophrenia. You actually need to take them to a clinician to sit down with them and actually talk about it. One last question here before you may jump in with more questions is, somebody said, what is the best treatment for schizophrenia? The best treatment for schizophrenia is actually medication. And there are lots on the market, and they're prescribed by psychiatrists and physicians. I tend to use a drug called clozapine. It works in about 30 to 40% of people. It can stabilize them, and it's something that we recommend. Fortunately, talk therapy, which is what psychologists do, has no effect on schizophrenia, so that's important. Somebody's asked here, what vitamins are good? Well, unfortunately, vitamin supplementation has not been shown to provide much benefit, because this is actually a chemical issue in the brain that we just, even in 2022, don't understand.
I hear you, Doc, mention that therapy, like talking face-to-face therapy, does not work for schizophrenia, and that really concerns me, because one thing that I'm always aware about when it comes to mental health is how medication can be so deterrent to someone's mental health from where they actually began. So if there is no medicine, if there is no alternative to medicine for schizophrenia, really, how well are you going to be after you take all of those pills? Are they going to affect you in some way? Are you going to become better?
Yes, absolutely. There are many schizophrenics that actually function in society, and what it does is it calms you down. It in a substantial portion of patients, removes their delusions and hallucinations. They're able to function. They may still sometimes hear the noises or see things, but they learn to ignore them, and the medication seems to blunt and suppress some of the more active episodes, particularly those that have, you can have what's called paranoid delusions, where you always think somebody's chasing you or somebody's after you. Those things begin to abate. So that's important. It is unfortunate, unlike stress and anxiety and panic attacks, which can go through cognitive behavioral therapy and talk to a psychologist, this is actually what we call an organic psychosis, something wrong with the brain itself that needs to be managed. And until we find a test like a blood test or a scan test or an EEG test that can actually determine what is and how is schizophrenia, we're really stuck in the dark in terms of drugs. So the drugs really suppress the brain from being overactive. Somebody's asked a very important question here. I must answer it. It says, I have a family member who is a schizophrenic. Is it safe for a schizophrenic to raise a child? Now, with psychiatric conditions, there's been a revolution in the last couple of decades and deinstitutionalization of psychiatric patients. In other words, we put them out in the community now. And most mothers with schizophrenia have the opportunity to raise their own children and actually have demonstrated a desire to have a meaningful relationship with them. So we don't dismiss the issue of a mother who is schizophrenic wanting to raise a child. So it's not a no-no at all. So that's important.
Yes. Thank you so much, Dr. B, for coming on the show today. You know, it can never go unsaid how much you do for the people out there that are listening, giving them tips every single Sunday about how to better themselves. Thank you so much.
It's my pleasure. Our topic next week is a big one. It's called snoring.
Ooh, that's an interesting one. I hope I'll be there for this one.
Talk to you later.
Thank you so much, Dr. B. And that's how we wrap up the Health Check.
Health Check was proudly brought to you by First Capital Bank. Belief comes first.